Good morning, everyone. Welcome all of you joining the public presentation organized by the Occupational Health Center. Today's topic is about reducing risk for those who with food allergies in the workplace. We are so pleased to have Lisa Begg. She is the registered dietitian who works at the Klinic Community Health Center in downtown Winnipeg. Lisa works with individuals, families, staff, and not-for-profit agencies. Lisa seeks to understand her clients' unique circumstances, interests, knowledge, and resources. She provides us education in various ways via feedback, understanding, sharing of knowledge, resources, and skill development. Lisa's goals are to increase her participants' confidence and self-efficacy to improve their nutrition and health outcomes. Over the years, Lisa also has participate in initiatives, improve food security, such as participating in food costing projects and partnering with local groups that provide free and nutritious food to clients. We acknowledge that we are gathered on Treaty 1 territory, and that Manitoba is located on territories of the Anishinaabe, on the Nunavut, Dakota Oyate, Denisoninik, Inuit, Ninestuhek nations, and on the national homelands of the Red River Métis nations. We acknowledge that northern Manitoba includes territories of the Inuit. As we gather on Treaty 1 territory, we recognize Treaty 3 territory, in particular Salt Lake 40 First Nations, the sources of Winnipeg's clean drinking water. We also acknowledge Treaty 5 territory, including Nelson River, which provides us with access to most of our electricity. The Occupational Health Center acknowledged this devastating, lasting, and ongoing impact of settler colonialism on Indigenous peoples and a deep lack of action toward truth and reconciliations. OHC has embarked on a process of learning about Indigenous peoples' history and cultures, and our roles as settlers with our staff, board, and volunteers understand the guidance of knowledge, people Clayton Sandy. We commit ourselves to active accountability, truth, justice, equity, and reconciliations. For participating in this section, you're seeing that this session has been recorded. So we'll be sharing the link to you after this is available and also share on our website and social media. And you on the Q&A, please put your comments and all the questions on the right side of the screen on the chat box, and presenter Lisa will go through it afterwards. And please connect with us if you have any more questions, or even if we cannot cover all the questions, that would be great. For some of the folks doesn't know about OHC, we are the Community Health Center located on 167 Sherbrooke Street, the same office, same building with Lisa, with the clinic, the K, and the CIRC. We are the nonprofit organization funded by Winnipeg Regional Health Authorities. We provide the services to the Manitoba workers with work-related health issues and work closely with the Joint Workplace Health and Safety Committees for training. Our service is all free. Please visit our website, ohcmb.ca, for more information and resources. Now, this is the time to join me to welcome Lisa.
Okay, great. Thank you. Thanks, Tiffany. Okay, I'm going to start my screen share, and I guess you can hear me, so then we're good to go. And at the end, if you have any questions, I will try my best to answer your questions. Okay. So thank you so much for having me. I'm really excited to do this presentation for you today. It's called Food Allergy Awareness in the Workplace. So why discuss this topic? How did this topic come about for myself? So in 2021, we were moving from our location on Portage Avenue to 167 Sherbrooke, and we had a new building. And one of our objectives was to know how to accommodate staff who have food allergies, as that was brought up as a topic of interest amongst staff. So there was a small subcommittee that was looking into what information already existed for how workplaces address food allergies of their staff. And so we had looked into the logical spots for that information, the WHA Insight, U of M Libraries, PubMed, Up to Date, which is a medical database for information about food allergies. So there wasn't a lot of information in those locations. We did ask occupational health what they know about how workplaces should address this, and there were no requirements for public workplaces to have a food allergy policy, but rather to focus on good food handling practices. And so we ended up utilizing in Up to Date, they have 2 public advocacy groups who really have a lot of the robust and current information on food allergies, and they actually have different guidance on what to do in a workplace setting as well as school settings. But for this presentation, we're talking about the workplace. So the Food Allergy Canada is the not-for-profit group in Canada, and FAIR Food Allergy Research and Education is the US counterpart. And so those are 2 groups that mostly are informing this presentation today. And you'll see on the slides I have on the footnotes where the information on those slides are coming from, whether that's Food Allergy Canada, FAIR, or other agencies like Health Canada. So an overview of what we're going to do today is to look at food allergies in general and talk about the priority food allergens. We're going to look at signs of an allergic reaction and how to respond. And we're going to look at how to reduce risk for those who have food allergies in the workplace. So hopefully those topics are of interest to you, whether you're coming as a staff person, as a person who has food allergies, or even as management and wondering how to address this in the workplace. So just a background, the prevalence of food allergies. It's estimated that food allergies are affecting as many as 3 to 4% of adults in westernized countries like Canada, and as many as 6% of young children. Food allergies are more common in younger children, and sometimes they outgrow those allergies, and sometimes they persist. About 2 million Canadians may be affected by food allergies, including over 600,000 children, and 1 in 2 Canadian households are impacted by food allergies. That's fairly significant. And some interesting additional facts are if you have a food allergy, you're at greater risk for having another. And you are more likely to have a food allergy if your sibling or parent has one. And other associated conditions that can increase your risk for having a food allergy are asthma, eczema, and hay fever. So Health Canada has identified priority food allergens. There are 10, and one of which is not a food but an additive. So although any food can provoke an immune response, a few foods are responsible for the majority of food allergies, and these ones are most frequently linked with severe allergic reaction types. So in no particular order, we have peanut, egg, wheat, and triticale, which I believe is a derivative of wheat or a type of wheat, mustard, sesame, milk, tree nuts such as cashew, pecan, walnut, hazelnut, pistachio, macadamia, Brazil, and pine nut, soy, fish, crustaceans, so that would be lobster, shrimp, crab, mollusks, which are scallops, oysters, and mussels, And then sulfite is a preservative that's added to foods to sustain shelf life and to reduce microorganisms in food. So these are the top 10 priority food allergens. So why do people seem to develop food allergies? So there's no easy explanation to explain the prevalence of food allergy. One theory is the dual allergen exposure hypothesis, suggesting that initial exposure to the food allergens through the skin, on the skin, especially in babies with eczema, can lead to allergy, while oral exposure, eating the food, can actually lead to tolerance. Another theory is the hygiene hypothesis, suggesting that people in Western countries are living in cleaner, more sanitized environments, and their immune systems are shifting towards developing allergic responses to certain foods and away from fighting germs or infections. And interestingly, so based on that topical skin-related allergy response, the Canadian Society of Allergy and Clinical Immunology and the Canadian Pediatric Society have come out with guidelines for introducing more allergenic foods to children who are at high risk for developing food allergies because maybe their parent or sibling has an allergy or they have the eczema or asthma or hay fever. So the new guidance is to actually offer orally those more allergenic, potentially allergenic foods like peanut and egg by 6 months, if not even a little bit earlier, depending on the child's readiness to be able to eat solid food, but actually to introduce those foods earlier orally. And this, it says this will not stop all babies from developing food allergy, but it has been shown to drop the rates of food allergy quite substantially. And testing for food allergy before introducing these allergenic foods is not required. So that's really interesting. And you could check out that document. There's a few more pages to it that would be easily found online. So how much exposure is a risk to the individual who has a food allergy? For most people, eating or ingesting the allergen poses the greatest risk. Allergic reactions are caused by specific proteins in the food. Food odors do not contain protein. However, steam can carry food proteins, like cooking fish and inhaling the steam can trigger an allergic reaction. So even a trace amount of an allergen, for example, transferred to a serving utensil, does have the potential to cause a severe allergic reaction. So that's why it's important to tell others about your food allergies to avoid accidental exposure. So what actually is an allergic reaction? This involves the immune response. The body is seeing the food, often the protein in the food, as a threat. Antibodies called IgE, immunoglobulin E, and chemicals like histamine are released, and histamine causes a reaction in the respiratory, gastrointestinal, skin, or cardiovascular system. So this is an immune response, and it is different from somebody who has a food intolerance. So that would not initiate an immune response. That would be more gastrointestinal and is not an immediate life-threatening thing, food intolerance. So this is a food allergy, and that's a different thing. And it's also different from celiac disease, which is different. Okay, so possible symptoms of allergic reaction. So in the skin, there could be hives, swelling of the lips, face, tongue, itching, warmth, and redness. In the respiratory system, there could be cough, wheezing, shortness of breath, chest pain or tightness, throat tightness, a hoarse voice, nasal congestion, hay fever-like symptoms such as watery eyes, sneezing, itchy runny nose, and trouble swallowing. In the gastrointestinal system, there could be nausea, pain, cramps, vomiting, diarrhea. In the cardiovascular system, there could be paler, bluish color skin, weak pulse, passing out, dizziness, lightheadedness, and shock. And other less probably thought of symptoms could be anxiety, sense of doom, headache, uterine cramps, and metallic taste. And interestingly, in one individual could have different responses each time. So it's not that necessarily so that the person will always have the same kind of symptoms. So anaphylaxis, this is the most serious type of an allergic reaction. Food is one of the most common triggers of this. However, insect stings, medications, latex, and exercise can also cause this type of reaction. So anaphylaxis is very serious. It usually involves two of those body systems, though it could just be one, and it can occur rapidly within minutes, or it could be delayed up to several hours, which is less common, and it's considered a medical emergency requiring immediate treatment. So as you probably know, epinephrine is the only treatment shown to stop a severe allergic reaction, and that's like that is in an EpiPen. It helps to reverse life-threatening respiratory cardiovascular symptoms by opening the airways and improving blood pressure. And a common mistake is waiting too long to give epinephrine. And really, it is safe to give even if you're not sure. It's injected into the thigh muscle, and it's recommended to have the person to be laying down or sitting down when this is done, and to call 911. So even if the symptoms seem mild or stop, it's still recommended to call 911 because symptoms could recur. So food labeling laws in Canada. So the Canadian Food Inspection Agency and Health Canada regulate food products, and food manufacturers are required to list those 10 priority allergens. As you would see in the picture, this product, it says contains wheat, soy, and milk, and it says may contain mustard seeds and sesame seeds, and it says baked in a peanut-free facility. So these are messages that are required by law, and the word contain means it does contain, may contain. That usually means that the equipment that is used at the facility might be used to produce two different products. And so it's cleaned in between, but still there could be a risk of cross contact of the particles from the other food. So it's still considered a risk, and it's still recommended to avoid for a person with food allergies, because research has shown that in studying contents that there actually has been found to be enough food particles to cause a severe allergic reaction when it says may contain. The term free from, it's still recommended to read the ingredient list, because it might actually include an ingredient that you want to avoid. It's recommended to avoid products that don't list ingredients, and to avoid bulk bins, as there could be cross contact of foods. When in doubt, to not eat a food, and to triple check your labels when you're at the store, when you bring the product home, and before you serve it to the person with a food allergy. And this is kind of interesting. Labeling laws don't cover certain non-food products like vitamins, skin cream, pet food, modeling clay, and finger paint, which may have wheat and egg. So when you're thinking about preparing food, whether you're at the workplace and having an event, or doing this at home or for a friend, to think about avoiding cross contact. So that's a specific term to avoid moving the particles from one food to another. And so it's not cross contamination. That is talking about microorganisms. So it's called cross contact. So here's some examples of where food could accidentally be cross contacted for the person who has allergies. So say you're at a barbecue and the person has a milk allergy, and you're using you used the flipper to flip the cheeseburger and then moved it to the plain hamburger. So that could move milk products over to the plain hamburger. At a potluck, eating nuts and bringing them to your mouth, and then not washing your hand and touching a knife handle to cut cheese, and then the person with the allergy touches the knife handle and then maybe brings the cheese up to their mouth, and then the nuts get brought up to the face. Touching shrimp and then not washing hands and making a salad, dipping a knife with peanut butter into a jam of jar or margarine that's going to be used by everybody. At a staff meeting, moving a serving spoon from one dish to another, using a deep fryer that's had chicken strips that has wheat for a person who can't have wheat, and then making fries and then giving the fries to the person who can't have wheat. And another example is not covering a dish in a fridge and then the sauce drips onto other foods. So it's just to be mindful of that. And just to say, not everybody has food allergies, and maybe there's nobody in your workplace who has a food allergy, so you might not have to be as cautious. But when you know, say that a person's allergic to green pepper or to tree nuts, then you're more aware of these things, and that really does help to know how to address that. So here's advice. When you're preparing food for the person with the food allergy, it's recommended to prepare that food first. Wash hands with warm soapy water, wash down counters with soap and water, and use a paper towel to wipe the counter down, and use separate cutting board and utensils. It's actually recommended to use warm soap, how to properly clean surfaces and remove the allergens. It's recommended to use warm soapy water with a paper towel or a new dishcloth, or antibacterial wipes, because it's more about the particles and removing the particles. It's not about neutralizing the particles, it's more about removing them. So those two products do that the best. It's not recommended to use sanitizing gel, that will not remove particles, and water alone will not. And also to be aware that sponges can redistribute food particles more easily. So it's best to have a new dishcloth and to change that daily. So in the workplace, who is responsible for reducing risk? So the onus is primarily on the individual with the food allergy. However, workplaces can support the person to help reduce the risk. And the main key players would be human resources and management, the workplace health and safety committee, and staff, in the sense that staff is being provided the education. So here are 5 main steps to kind of think about, and a multi-pronged approach is recommended to reduce the risk for allergic reaction. And this can actually go a long way to reduce the risk of having an allergic reaction. So 1, supporting the individual with the food allergy. 2, planning how to respond to allergic reaction. 3, educating staff on food allergies. 4, having a process for cleaning surfaces where food is prepared, eaten, and stored. And 5, having processes for food events. And this information is coming from Food Allergy Canada and FAIR. So number 1, supporting the individual with the allergy. So at hiring and annually, this is an idea to ask staff if they want to voluntarily disclose food allergy. And that would be, for example, human resources. Here's an example of a form that could be used. And this is, I believe it's at Food Allergy Canada or FAIR, this particular plan that could be kept on the employee's file. So keeping an emergency contact info on what the allergens are, and where an EpiPen is kept, and if other staff are going to be informed or if the staff person wants to have other staff informed, and if the staff person would like to request any accommodations in the workplace. When I think of our workplace, I know a couple of people who have food allergies, and I know that they usually just avoid eating in the lunchrooms, and they kind of just want to keep a low profile. So it's, but accommodations could be made, say the person, if it's reasonable, like if they would like certain, I don't know, location where they could put their lunch or where they could eat more safely. So those are the kind of things that could be asked. Number 2, would the workplace would be smart to know how to respond to an allergic reaction. So this would be the responsibility of human resources management and the workplace health and safety committee. They could educate staff, and it wouldn't take too long, just on the possible signs of allergic reaction and how to respond. They could educate where the EpiPen is and to know to call 911. So posters could be put up in wait areas or areas where there's food, such as lunchrooms or staff rooms. So these two posters come from Food Allergy Canada, signs of an allergic reaction, and then the poster to the right is how to inject the EpiPen and to call 911. So providing staff with education on food allergies is another way that can go a long way to helping to reduce risk for allergic reactions in the workplace. Um, for example, you can educate food allergies staff on food allergies through newsletters, posters, short videos. You could talk about sort of what we've talked about in this presentation. What are the top priority allergens? What are the signs of an allergic reaction and how to respond? How do food particles get transferred? So all of this can just increase awareness so that people understand and know. Um, it can be helpful to ensure that the staff who prepare or order food are aware of the proper techniques of how to prepare the food safely. And you can also review with staff how to properly clean before and after eating. For example, using the soapy water and paper towel instead of just water or that sort of thing. Number 4, for the workplace, it would be helpful to have processes for cleaning surfaces where food is eaten and prepared and stored. So that would be think about where that might be in your workplace. So in our workplace, it can be, fridges. We have a few fridges. We have some kitchenettes. We have a lunchroom when we're eating together at a staff event. And actually, we do eat at our workstations, and sometimes food is brought in to be shared. So it's to think about where do we end up having food in our workplace, and then how can we clean those surfaces properly and be more mindful of that. So talking about that and explaining to the staff, or even looking at where do we do that and could we move it somewhere if there's a person with an allergy and then there's food right there behind them, maybe it would be better to put it farther away and then to have the proper cleaning supplies right there readily available. That makes a big difference. And also to even consider to delegate somebody to clean, say, a certain kitchen area that might be part of their job description at the end of the day to make sure that a new dishcloth is out and that the supplies are stocked up and that the counter is being wiped down, that sort of thing. So it could help to assign somebody to that kind of responsibility. And lastly, it can be very helpful to have processes for food events. So anytime that there's going to be a food event, whether that's a staff meeting or going out for food, to ask all staff if there's any allergies at registration and just have that embedded into a registration form. For potlucks, it could just be a routine thing to say, list, do you have any allergies that people could note? And then if the staff person who does have an allergy, to even ask them, is there something that you could eat that I could make, or even show them a recipe that you're thinking of making and see if there could be any swap-ins that would make it safe for them to eat at the event, to think about having a serving utensil for each dish, and to move any obvious allergen containing food away from other foods and even cover that and to mark it, and to encourage staff to wash their hands before and after eating. That can go a long way to prevent the spread of food particles. And I'll just give you an example. At our workplace, a staff person is allergic to tree nuts, and then some food was being, put in the general staff area, and the person with the allergy was avoiding those foods, but was eating something that they could have. And later on, they did experience an allergic response, and it seemed that perhaps the food particles got transferred to a photocopier machine, and because they hadn't actually ate any of the food. That was part of it that I forgot. So they hadn't eaten any of the food, and then they touched like a photocopier that must have had a particle of food on it. So just to be mindful of where foods are in the workplace and cleaning surfaces. So Food Allergy Canada has really unique and creative recipes for ideas if a person, has a food allergy like to egg or milk or sesame. So you can look through their recipes to see and just get some ideas for the person who might have an allergy of what you could make. So just to recap, it helps to have a multi-pronged approach for addressing food allergies in the workplace, and each of these steps can go a long way to prevent allergic reactions. So again, that's supporting the individual with the food allergy, planning how to respond to allergic reactions, educating staff on food allergies, having a process for cleaning surfaces where food is eaten, prepared, and stored, and having processes for food events. And today we looked at an overview of food allergies and priority food allergens, signs of an allergic reaction and how to respond, and how to reduce risk for those with food allergies in the workplace. So I hope you enjoyed that presentation. I guess I'm done a little bit sooner. And if you have any questions, please submit those and I will try my best to answer them. And I will just say that I'm not an expert in allergies. So I will see if I could answer your questions. Thank you.
Thank you, Lisa. So we got the questions from the chat from Monica. So if you could open up on the Google document, asking about, because we're using the common microwave to reheat the food, right? So how we could avoiding that? So do you think we should clean it up after we use, or what's the suggestion or recommendation for safety?
Yeah, that's a good question. I did not come across anything that said specifically what to do in that case. The food particles, I guess, are not necessarily on that's a very good question. I'm not totally sure how to answer it. I would say, I think a lot of people who I know, they might cover their own food that is in the microwave. I had not come across anything that showed that that in particular is a big risk to be reheating your food if you have a cover over it. I would think maybe to get a separate microwave just to be cautious, or to make sure that it's regularly cleaned with some warm soapy water, because the food particle has to get ingested right from the contaminant food particles. So I'm not sure. That's a really good question. And for sure, when I look at microwaves, I do think, But the steam is an issue, right? So that would be for, yeah.
This is another question about the hand sanitizer.
Okay.
You see that on the document?
Can hand sanitizer be used before and after eating instead of washing hands with soapy water? Well, apparently not. No, it's recommended to, if you had the allergen food, if you were eating, say, toast with some cashew nut butter, you would want to, it's more about not transferring those food particles, onto doorknobs and other things. So it would be you eat the food and then use warm soapy water to wash that off. A hand sanitizer would just kind of move the particle around and it might still be present. So they've looked at studies of, does sanitizer remove the particles, and it doesn't really. So it would be recommended to use warm soapy water and wash your hands to wash it away. So sanitizer is good for killing germs, but it's not good for removing the food allergen particles.
Yeah, another question about frequent microwaving.
Do you think frequent microwaving increases the risk of allergies related to food? So I'm not sure if that is sort of, do I think microwaving increases the risk of allergies related to the food? So I'm not sure if you're kind of meaning, does that transfer the food particles to the person and increase the likelihood of an allergic reaction? I
I
I
think
don't
what I
know.
mean is about, as you mentioned, when the steam come up, the food particle will have been
Mhm,
staying in the microwave, right? The next stuff coming in,
mhm, mhm,
probably do you think that that will be related and kind of, yeah, it's so hard to avoid this, right?
mhm. You know, it's funny because like the microwave is one of the most commonly multiply used appliance, and I had not come across any advice on using a microwave, whether it's safe or not. But the steam, I mean, steam has to be kind of trapped. It's the water vapor, and then the food particles are in a steam. So an odor, like in a microwave, it rotates the food particles to create warmth. So it's not necessarily producing vapor steam. But it's a very good question. I don't totally know. I don't know. We'll all have to look it
That's
up afterwards. We'll go to
the,
Food Allergy Canada.
yeah,
Definitely wiping it, washing it down inside with warm soapy water and using a paper towel. And then for the person who has the allergy, I would think covering their food while it's being heated, that would significantly reduce the risk.
yeah, I strongly
Hmm.
believe that. You're right.
Hmm.
Any more questions to Lisa? You could submit on chat. Yeah, I find, the food allergy, you know, in the workplaces, seriously, this is a really common issue. But however, we always ignore it, not even talk about it, right?
Hmm.
So this is really, really good for have you here. At least this is such a reminder for us. Oh yeah, you have to pay attention, how our food, will be affecting to the next step. You never know. And even some of us may not already know we have the allergies on anything, but until we kind of come across with that and touching this or whatever, right? So we have to be really careful, be mindful on everything what we do at the workplace, right? Making sure everyone stay healthy.
Yeah, it's to just be more aware and more mindful. And it's not to be scared or to be worried about everything that we're doing, but to be more informed. And then, maybe there aren't that many allergies at your workplace. There might be a couple. It's not that you have to avoid all of these foods. It would be to just be more mindful. And you can still even eat these foods where there are staff people that have the allergy. It's just to be more aware of how you're doing that.
Mhm.
Yeah.
Yeah, another question just so from Paula, right? If the person the people doesn't have the EpiPen, what is the recommend in the place of the Benadryl? Do you think this is helpful or any other recommendations?
I had read that if you suspect that there's like it could be a severe anaphylactic type reaction, which I guess is kind of hard to know. It generally involves two of those body systems, but it might not. It is recommended to take the EpiPen over an antihistamine or a Benadryl. Um, that's what food allergy advised, and they said you could take those products afterwards. I do know that some staff people take those things to reduce the histamine response, and I guess it's to be still very cautious and to have the EpiPen there. um, so it's recommended the EpiPen if there's signs of a severe allergic reaction.
Yeah, just want to check. Yeah, because Monica just mentioned, because she had been seeing lots of people just slightly open the lid up for one of food, right? That's why she asking about microwave things. Yeah.
Mm-hmm.
in the workplace, right? Yeah. But anyway, this is really, really good question. We have to kind of.
We have to look into that one because that's a major
Yeah.
thing in a workplace.
Hi, folks. Do you have any more questions before we wrap up the sessions? Okay, if not, then I will conclude the session here. On behalf of the Occupational Health Center, thank you so much, Lisa, to bringing this really informative session. This is really, really great information to remind ourselves have to be really careful at the workplaces, to making sure the allergy respond and kind of that risk bring it to anyone around us, right? So, and also thank you all the participants joining this morning with us. So thank you. Then we will see you next session. Have a really, really great day and enjoy the spring coming. Yeah. Okay, bye everyone. Take care.